If we don't think that the vacuum is going to work, and we don't think the baby's head's far enough down to put the forceps on safely, then we do talk about doing a cesarean section. Cesarean sections in North America are pretty common. The rate of cesarean section in British Columbia is somewhere between 1 in 3 and 1 in 4 women that come in labor will end up having a cesarean section. So it's fairly common. It is something that we do frequently. The risks are pretty low, not completely zero because it's a surgery, but they're pretty low. And we actually, in Chilliwack, the operating room is right down the hallway from where you're laboring. So it's 1 or 2 doors down. We go into that room, and same as I said about the breeches, we get the operating room nurses to come up and the anesthetists to come up. We get the anesthetist to give you something called a spinal anesthetic. So they paint up your back, they freeze the skin on your back with a little sort of mosquito bite, and then they put a needle in and put some freezing right in the spine, right beside where your nerves are running. And then we go ahead and we do a spinal anesthetic and do a cesarean section. As I said, up to about 1/3 of babies in BC will be born by cesarean section. It's a relatively safe surgery. The complication rate is somewhere in the 1 to 5% range. It's small, but it's not zero. Almost all the cesarean sections in Chilliwack will be done with a spinal anesthetic, and mom will be awake. So you're frozen from about your chest down. You will feel pushing and pulling. You won't feel anything sharp. In fact, we actually pinch your skin before we start, just to make sure you're not going to feel anything sharp. And then once we know that the spinal anesthetic is working properly and you can't feel that pinching, and we get dad to come up, sit at the head of the bed beside you, and away we go. The surgery itself takes about half an hour. From the time you go into the room to the time you come out of the room, it takes a little over an hour. We go down through the layers. We get the baby out. Most of the time we'll wait for about 30 seconds, let the baby have a little bit more of that cord blood, and then after 30 seconds, we'll clamp the cord. We'll hand baby over to the pediatrician. The pediatrician will do their usual count fingers and toes things, and then once they're done with that, babies come up to mom and sit right on mom's chest here, even before we're finished doing the cesarean section. And then we'll get some skin-to-skin happening. We know babies do better with the skin-to-skin, so the sooner we can start that, the better. And then while you're doing the skin-to-skin thing, we'll finish doing all of our work for the surgery. Once we're done that, dad and baby, or whoever's in the room with you and baby, is going to head out of the room, and we're going to wait. They're going to wait outside for you. We're going to move you over to a stretcher, and then once you're out of the operating room, baby's going to come visit with you right on your chest there. Baby's going to ride with you down to the recovery room. Once you're in the recovery room, baby's going to go to the other person with you for a couple of minutes while you get all set up, and then we're going to do some more skin to skin, and maybe even try to see how baby's going to latch for that first breastfeed. We can get that even started down in the recovery room. We try to do as much of that stuff so that we keep you and baby together as much as possible, and try to keep the experience as much like it would have been if you were having a vaginal delivery as we can.